Hello. So Simon, Jason, and myself are going to talk about Blue Button 2.0 and what that is, and also we recently attended the Blue Button Developer Conference in Washington, D.C. last month, so we're going to kind of talk about what we heard there, and then at the end there will be time for questions. So Seema Verma is the administrator of CMS, and she did the keynote speech at the Blue Button Developer Conference. And some of the things that she talked about, the first thing she opened with was that by 2026, we'll be spending $1 in every $5 on healthcare. She also talked about EHRs, electronic health records, how they merely replaced paper silos with electronic ones. So she's really passionate about breaking down those silos and having people having access to their data. She said we're at the beginning of a digital healthcare revolution. She sees that there are tons of possibilities and opportunities to improve the healthcare system and the data that is part of it. She said, at a time when we're sending Teslas to Mars, patients are receiving health records in forms that are completely outdated. And she told a personal story that I tried to find a video for online, but I couldn't. So I took some notes, and I'm going to try to tell you about what happened to her. They were on a family vacation, and her husband and kids were at the airport going back home to Indiana, and her husband collapsed in the airport with their children. She was not with them. First responders called her and started asking questions about his medical history, and she couldn't answer them. They ended up spending a week in the hospital outside of where they live. And when he was discharged, she said that they left there with 5 pieces of paper and a CD-ROM. She was like, most computers don't even take a CD-ROM. I didn't know how to use a CD-ROM. And then she talked about sending Teslas to Mars and just how asinine that is, that today you have all of your financial information online, you have access to all of that data, and you can do all kinds of cool stuff with it yourself, but when it comes to your healthcare data, it's just so antiquated. She says that CMS is to lead by example with the advent of the Blue Button 2.0 and is asking all insurers and providers to do the same. So we're going to talk about what Blue Button 2.0 is and what they've done to lead the charge, and then kind of what might happen next. She also talked about the importance and power of aggregating data from things like wearables, claims, genetic information, all of this consumer-mediated data, and not just providing that data back to the patient, but turning that data into information that people can actually use. So it's pretty cool that CMS, that part of the government, is taking the initiative to kind of move things forward from a healthcare perspective.
Cool, so, hey, wow, awesome. So, originally there was the Blue Button 1.0, which you may have seen because it's been around for a while. The first time I saw it was I logged into my Humana and they're like, oh, there's this blue button. And I'm like, what does it do? And kind of similar to the story that Sarah told about SEMA, it's, I get a CSV or a PDF of my stuff, like, cool, I guess. Like, that doesn't really help me. So, you know, Blue Button 1.0 has been around for a while, like 2014. And surprisingly, for me anyway, quite a lot of people used it. About 5,000 people monthly access and download their data because, frankly, they don't have any other way to get to it. So when it comes to, you know, like Sarah mentioned with SEMA saying that CMS wants to lead by example, there's an initiative that all payers will kind of provide a similar API to Blue Button so that, you know, patients can control where their data goes. So when you hear the phrase consumer-mediated data, I think it's like easy to gloss over that and just be like, oh, it's just a different type of data. But like when we say consumer-mediated, what we're really saying is like it's consumer, patient first. They are in control. It is their data. It is not ours. It is not our competitive advantage. It is not our. It is not what makes our stock price go up. right? It is their data that they've trusted us with because they trust us to provide them with benefits and services. And so that's really kind of the key when we talk about consumer mediated. And this was, the first step toward getting them access to their data from, again, these digital silos that have been created in lieu of paper ones. So, switching gears a little bit, but you'll see how it works. The United States Digital Service is basically an association within the government that was started in the Obama administration. They were the ones that fixed healthcare.gov and really got all that going. They've continued to operate through that administration and on into the Trump administration. And what they do is they are basically contractors, civilian contractors who get brought in. And they call it basically a tour of duty because the terms are limited. You only get renewed every so often, and the max you can do it is 4 years. And what they do is they work fairly similar to the deck in the sense that they are product managers, designers, and engineers who come in as part of the USDS and then work with individual government agencies to spin up new products and provide services that they can't provide today. So why that's relevant here is the USDS is responsible ultimately for delivering Blue Button 2.0. On the right there you can see we had a chance to tour in the morning before the conference started the USDS office that's just right up the street from the White House. This is one of the dashboards they had up in there, and they were talking about how many veterans they've served, pending applications they have for all these different positions, and who are the newest team members. And it's a really kind of scrappy, really close-knit environment. But for the most part, people in USDS go out to the agencies within the government and work directly on site there with them to help bring these products to bear. So we had an opportunity to see them and to talk with them and ask questions specifically about the API, how we've implemented the interaction with the API, and get some kind of real boots on the ground, first-hand pro tip kind of advice from them.
On the left is Kat Grimes. She's a product manager at USDS. And then on the right, for those of you that are part of the Blue Button Google group, that's Mr. Mark Scrimshire. He's out there posting stuff all the time, so you may know that name. So Blue Button 2.0 is basically an API that releases 40 years of Medicare Part A, B, and D data. Right now it's at approximately 60 million members and growing. It includes information on the beneficiary's health, including Medicare coverage type, prescriptions, treatments, procedures, and cost. And the point is to allow the beneficiaries full control over how their data can be used and by whom. So they've released this API for companies to go out and build cool stuff with, but then the beneficiaries themselves can choose which apps they want to share their data with. So it's kind of cool how they've gone about releasing this.
So when you really get down to how it works, it's an API just like any other API. The innovation here is really thinking about like the first time you've actually dealt with health data, and to be able to share that out and to be able to publish that out via an API is new. Traditionally, you always have to think about like how health data has always been treated with PHI and HIPAA and the regulations. It's always been build a moat, protect it at all costs, and don't let it out of this building with invaders coming in from all directions. Now here, this is really the first time it's been implemented so that you can actually see that health data for consumers can be shared securely, it can be shared with the people that you want to share it with, and it can be, and then the controls of it can be loosened out from the organization perspective back to the consumer level. The actual technical detail of how it works like just any other API. It works with OAuth for authentication, it works with JSON objects, for request objects, and response objects. But the idea of it actually being health data, that it is PHI, and you can share it out via an API is the innovation and the technical implementations here.
I forgot to do what I said we were going to do at the very beginning and give a shout out to Patrick Murda. I don't know if he's here, but we've lifted some of these slides from a wonderful presentation that he created, and he really was the person that came over here to the deck and really educated us on the blue button work, so we definitely want to give a shout out to him. Hopefully he watches this. So these are just some of the pieces of data that's available from the blue button API, but we also wanted to talk about what it's not. We mentioned that it covers parts A, B, and D of Medicare, but it does not include part C, which would be like the Medicare Advantage plans that we offer, United, Aetna, all those other parties. And we had a few other things.
Yeah, so like I mentioned earlier, how CMS wants the payers who provide Part C benefits to expose those APIs. Once those APIs exist, I think the plan is to be able to integrate it back into this so that it's a completely open system for anyone on any type of Medicare plan. And it really levels the playing field for all people providing access to their data to whoever they want. And it's a really, I mean, obviously, I feel silly saying this, but like I need to. It's an amazing business opportunity for anyone because you have now this capability to create experiences for a demographic of people that may be technologically underserved because the common thought is that, well, seniors don't use technology, and that's obviously changing. And so now it's for anybody. It's a really, kind of like she said, it's the beginning of the digital health revolution. And I think when you really understand that that's why, because now you're opening up so that so many people can create experiences, because before it was, hey, only we can create an experience because we have the data, or Medicare and CMS can create an experience, but now it's like if the patients are in control and it's out there, then anybody can go and create these experiences. So really quick though, when we talk about the different, we talk about claims and their DOBs, there are multiple breakdowns that talk about all the different types of claims. Hey, what happened there? All the different types of claims, what they are, what they have in them. There's some really specific, like, hey, there's a hospice claim, and you can like look into that and see like really specific hospice-related data. So it's not just super general. They have about, I think, 7 to 9 different claim types, 3 of which you have access to through their sandbox, their pre-production environment, basically. But yeah, I mean, in general, it's just really not this free open API that anyone can call. It's not a bulk export of data. It's not, oh, once this data gets into the company that's providing services and they've granted access to, that anyone can just go do all this great data mining on it, because it's really about putting people first and respecting their privacy and what they've agreed to when they grant you access to their data. And that's pretty clearly outlined in the privacy policies and the terms and conditions that each application or each basically provider of services has to outline, so that the beneficiaries can see that when they basically give you permission for their data.
Yeah, going along part of that, like what it's not, it is not a bulk export of consumer data. You can't query blue button data and get 10 million people's health records. It is an individual per user, per consent. So that's another important topic that I definitely wanted to cover. All right, so this slide really is, yeah.
Yeah.
Yeah, like a flute. So I wanted to cover what FHIR is with the data interoperability problems that we normally face within the healthcare industry, especially when it comes to health data. APIs generally solve a few problems for us as far as the transport layer of software engineering and the data science goes, right? It solves authentication, it solves authorization, It solves some security issues for us. It's also is a consent management platform. So there's a lot of things that API do for us, especially with the Blue Button API. It actually does a very good job at handling those types of problems. What it does not solve is portability. Just because you publish an API and you make data available doesn't mean you can take that data and put it somewhere else and make it use. The best analogies that I've seen for this normally come from like gaming consoles. You can play Madden on PlayStation 2 and you can play Madden on Xbox, but you can't play Madden on your Xbox with somebody on PlayStation 2, right? So that's what Fire solves for us. It solves the portability issue. Fire is an offshoot of a standard by the standards organization called Health Level 7. So Health Level 7 has been around for a while. We call it HL7. Version 1 was based upon the old EDI X12 technology, which is actually from manufacturing. It's a bunch of pipes and carrots and base 64 string. Not very human readable, it's not very user friendly, but it's doable. Version 2 was a little bit more verbose and it was manageable. At version 3, it became completely unmanageable, completely uploaded. There was horror stories of integrations that have been happening that require something like 60 pages worth of documentation to record one clinical measurement data. Like your high blood pressure is 60 pages worth of data that you have to parse through in order to get the actual values out. So that's what Fire solves for us. Off of that version 3 standard, they were like, well, this is unmanageable. We can't really do anything with this. So HL7 and a few industry leaders came together and came up with a new standard called Fire, and it's quickly gaining adoption throughout the healthcare industry. So, and I'm not going to bother reading that. You guys read that today.
So it wouldn't be a deck talk that I'm associated with if there wasn't a picture of something awesome from the 80s in it. So we chose Voltron. Because as part of the conference, what you see on stage there are representatives from Apple, or was it? It wasn't Apple, was it? Yeah, it was the cloud providers. It was Google, Microsoft, Amazon, and IBM. And Salesforce kind of was like, me too at the end, but like, they're not on stage, so whatever. Anyway, basically, they decided they're going to connect like Voltron and work on making sure that they can provide cloud services that make all the things that we create really portable across these, especially as it relates to health. So those are people from their healthcare divisions, and we heard some stories from some other people who worked more directly with that, talking about, if I go to Amazon, I have like these 6 services that I use to like create the thing I need to create. But if I go to Microsoft, it's like, well, that same analog doesn't really exist, so I have to kind of do this weird thing. So what they're kind of working on is the idea of these standards-based services for things that are going to be related to healthcare. And so that was kind of one of the big announcements that came out of the conference, because originally they wanted the announcements to be, hey, look at all these cool apps that people have built, and there were some demos that happened that day, and the demos were, they were okay, but like in the end they looked like, hey, here's that 60-page blood pressure measurement that Simon talked about, but now it's on your phone. So that's cool. So they're really doubling down on supporting this and driving standards across the cloud for what it means to provide these kind of services. So, and you saw that this year at HIMSS with Google's Health API, and I think it's just going to really continue from there. It was a really cool train.
So as of about a month ago, there were around 600 developers currently working on developing apps using those Blue Button 2.0 data. I'm not going to talk through each of these. These are just a few examples of companies that are out there using the data today. Some are in production, some are not. So feel free to jot those down or Google it if interested. Otherwise, questions?
On the previous slide, Maryland was a really interesting company. They're actually They're actually an offshoot of Google. They're Verily is a the health arm of Alphabet. So they have some real interesting future forward vision for what you can do with the Blue Button 2.0 API and fire standards in general. But as far as demos go, it wasn't.
I didn't quite get the sense how does it truly works. Like, so when, as a consumer, let's say I own my data,
Yeah.
then where do I go? Or how do we implement, like, as a provider, what we do, how do we use that API to serve that data?
Sure. So keep in mind these aren't members, because when we like, that's kind of our focus, right? And that's where that's like our mental prison, because we always talk about our members, but like these people are consumers. These are Medicare beneficiaries. These are people. It's all parts A, B, and D. So the part D, you get some crossover from, where we sell like PDP plans and things like that. But on the medical side, it's really just people who have traditional Medicare. So the way it works is it's basically like if you go to a different app and you'll see something like log in with Twitter, log in with Google, log in with something else. So when you start up an app, it's like, hey, log in with Blue Button, or just separately after the fact, it may have its own account system. But then when you log in, it's standard OAuth in the sense that you log in, CMS sends us back an OAuth token and a refresh token, and then we can use those to make requests to the API to get the data, and then create whatever experience we want to based on that. Because it's not just necessarily about like, hey, here's your data, that's cool. It's about what can we do with that data, how can we supplement that data, how can we create insights and inferences from that data to create experiences that are net new that don't exist.
So it's the CMS who has the data.
Yes.
Sharing the data.
CMS has the data, and their intention, and we spoke with them really specifically about this, their intention is that when we call the API, we persist that data. And we call them on some periodic schedule. It's 1 week for parts A and B and monthly for parts D, but you don't have a way to differentiate that, so you just do it every week. And when we do that, we just keep updating the data, and then we have our local copy, and we pull from there and then update it on some sort of schedule. Yeah, good on.
From a carrier perspective, how Humana can provide
How can they do what with it, I'm sorry?
From a carrier perspective, how can we utilize what's our opportunity?
Yeah, well, I mean, I think that's going to be up to each individual business unit to really understand like what that could mean for you, because like a variety of applications may have use for it. I mean, we may be able to see like pre-build a drug list for people based on their claims instead of having to have them put that in like, during an enrollment flow. Things like that. We may be able to see like, hey, you have these conditions, or that maybe we have a machine learning model on that says, oh, looking at this data, there's some type of inference we can draw that you may not already know about your own health, and give you like some actionable thing to do with it.
Like clinical follow-ups or
Well, also onboarding people that are currently on traditional Medicare. We have health information about you already as you're onboarded. So we can call the API and know something about your health history, so that we can actually pre-process some of your pre-authorizations as from the first day that member comes on board. But also I wanted to point out that when CMS built this wasn't the end goal. This was more like a proof of concept for them to show the industry that this can be done. You can share health data that you have behind your firewalls and let the consumers be shared out with different third-party applications, different third parties, whoever they want. This is about empowering the consumer. So when they built this, and they built it as an example of this is what is possible, this is what is possible for the industry, the payers and the providers to do. Our very first slide that right now they're asking us. Eventually, that's not going to be an ask; it's going to be a tell. So the earlier we get on board with these standards and these compliance methods, the better it is going to be for us.
Can you talk more about security risks, concerns, and how that is being overcome?
As far as the Blue Button API is concerned, the burden of security really is based upon the API provider. So The authentication mechanism is the Medicare.gov. The authorization obviously is on there also. The consent management for who actually gave consent, that access management is also handled by the API. So that's also handled by CMS. So as the users of the application, or the users of the API, the data governance of what we've collected falls under the normal data governance that we have for any health data. Did that answer your question?
Yeah.
Great.
Yeah.
Were any of our competitors at the conference?
No.
Did you hear anything there too?
No.
No?
Yeah, one of the takeaways that I got from the entire conference was like, payers are generally not included in these types of efforts. There was a lot of providers and healthcare networks. Some companies, startups from Silicon Valley, but like payers wise, like we were the only ones. They almost forgot we were there sometimes.
They're like, oh, you're a payer.
Wow.
And then they walked away.
So, I know like we have a lot of integrations with CMS to exchange the data. Does it help with any of the existing integrations?
No, because these are more like B2B, like business to business integrations. These are more like consumer to whoever integrations, right? It's like the shifting the focus between like, because that's like, if we're gonna like make up a new word, that's like business mediated data versus consumer mediated data, right? So the consumer's in control versus the legal entity, or however we want to phrase it, being in control. So it's really unique and separate from that. Yeah.
Was there any like conversation about health data more generally? And I said it because like it just feels like we're in this crazy time where like HIPAA feels like really antiquated in this age of like these crazy social media, and then you've got the data breaches. So we've got like this insane freedom of very personal information, and then this like the moats. I mean, was there any? I don't know.
I don't think there was any like kind of scent of like we're walking back HIPAA, or that we're less concerned with it now than we were. It's just that we're out of freak out mode. We're out of like helicopter parent mode. We're like, okay, like, you know, you don't need the kid to eat dirt, but like the kid can have a bologna sandwich, like chill out. Right? So that's kind of the way I would describe it, because we've been that parent who's like seatbelt arm, right? And now it's like the seatbelt actually works. Your arm is pointless. Like chill out.
There were a couple of legislative actions that they did talk about, things like that supersede, not really supersede HIPAA, but it's like an addendum to HIPAA, like the Cures Act that we talked about on the fires. Well, I didn't act, probably was on the slide, but the Cures Act specifically provides addendums and guidelines of how to share health data. So it actually mandates sharing of that data. It's supposed to give the power to the provider or to the user, the patient. So it allows the patient to own their data, and we have to make it available to them. That's actually part of HIPAA now. So HIPAA doesn't just block; it also has provisions to make it so that we have to share it out.
So the data that we have available for these members that are received, is that put back into Blue Button API? And how does that work? Since they own that data.
So that's kind of where they're talking about, hey, this Blue Button 2.0 API can be awesome if the payers provide a similar API so that we can integrate that kind of all in one place. So the one way they're talking about doing that is having a standard ingestion format, because ultimately those claims are paid by us, and so they don't go there like Part B's do. So they're working on they just want to use the FHIR standard and have a way for us to pipe that data to them so that we have one single place where it's all available. So they are very keen on getting our support for that. We spoke to someone in the Office of American Innovation who is like a Kushner direct report. Not that that matters, but like just so you know, he's up there in that office, and they're very serious about it, and they really want it to happen. Rustin?
Did they talk anything about how they're going to handle incorrect data that's housed within their own system? Like,
You know, they didn't really talk about that. I think the only real thing we talked about were when we talked about what happens like when claims get updated, their claims are adjudicated differently, but not so much that like the source of their data may be bad. I think they feel confident in the source of the data. They did mention that they switched sources midstream on this project. It used to be from some data warehouse and then they're moving it from somewhere else. So it may be a slightly better source of data than we realized because there's not just one apparently, which was news to me. But, so yeah, there wasn't anything specifically said about that, but they seem pretty confident in it.
I was just curious if like you met any of the developers there that were looking at it from an audit perspective, like obviously from a payer perspective, we can look at it and look at what's wrong, or from a consumer perspective, oh, I didn't go to the doctor, I don't know what you're talking about, there's a Medicare fraud.
Right. Yeah, none of that was really talked about. It was more about, you know, the access and all that, and I'm assuming any efforts like that are still ongoing. Matt?
One thing that Anish talked to us about in Boston that I thought was just interesting, is how, and you touched on it with Apple, how they're sort of advocating for interoperability within an industry that's not their own, kind of through the back door. They're saying, like in boardrooms, people aren't worried about like that they're weary of like when we adopted a fire standard, it's a lot of work and it's just risky. And but what they're doing is saying, you know, to integrate our tools with Apple Health Records, you need to be on the fire standard. And in those boardrooms, people are asking, are we Apple ready? Like, are we ready to? Are we able to utilize? Can our people utilize those tools? And so it's forcing. They're using their position to force an adoption of the fire standard within an industry that's not theirs. It's just unwilling to adopt other ones.
Yeah, another interesting thing about that is that, similar to the question about data governance and all that, you know, when you do Apple Health Records, it is the same fire standard, but it's all on your device and there's no intermediary between the health system and your data. It just comes onto your device. So that's kind of how they solve that. It's like, it's my device, I'm in control, again, consumer mediated. So just closing all those loops if you don't do that. Anyone else? Awesome, thank you all very much.